Okay. First, I'm gonna start off by apologizing because I know by my standards, and I'm pretty sure yours, I'm extremely late. But hopefully this works out. I have my wife and my daughter. Uh, this is all we deal with, just each other. So I'm gonna start off. My speech will be on the benefits of marijuana compared to the what they say the benefits of other painkillers are. So I'm starting off with my sources. My sources would be health.howstuffworks.com. We also have medicalmarijuana.procon.org. Then we have policymike.com, and we also have normal.com, which is actually a reform that they're trying to make the public aware of the laws of marijuana. Uh, normal normal.org, working to reform marijuana laws. Also, I have Science Creative Quarterly. Slide, please, baby. And I also have data provided by IFI Claims Patent Services. Okay, and I have these charts that I want to show you right now. You're not actually going to be able to see it because it's on the TV, which really sucks. I'm devastated by that. Okay, so going into my speech now, the benefits of marijuana. Nausea, for one, in trials conducted by the National Cancer Institute, two FDA approved cannabis based drugs. We got Drona, Drona, Dronabol, and we have Nabalone. Help to reduce chemotherapy related nausea and vomiting in cancer patients. When taken orally, the drug worked as well as or better than some of the weaker FDA approved drugs to relieve nausea and vomiting. Um, Also, it was it was used in a couple of studies as an appetite stimulant in a clinical trial conducted by the also by the National Cancer Institute. Patients with HIV/AIDS and weight loss found that increased appetite and stopped losing weight compared with patients who took a placebo for whatever most people take for weight gain or to stop weight loss or control weight loss. Um, Marijuana in a lot of studies was also used for muscle spasms, MS, pretty much the ability to relax muscle tension. In a 2004 study by the American Cancer Society, people with multiple sclerosis or MS who used cannabis experienced a decrease in muscle spasms and shaking. There's a number of different muscle related uh, issues that a lot of people were using these different pills and painkillers and muscle relaxers and things of that nature that were effective for the most part. But what you had to deal with that weren't foreseen or were not foreseen, or what may have happened, it was on the label or it may have been in a commercial, and at the end of that they had the silent where they speak really fast. You're just talking about the side effects. So the side effects pretty much outweighed what the medication was supposed to actually fix. Also, marijuana was used as a relief for pain. In a 2010 study done by the Canadian Medical Association Journal, 21 men and women, average age 45, were tested with four different strengths of cannabis. Over the course of 2 months, each test subject smoked a random strain 3 times a day for 5 days. Each one, they had no knowledge of the different strengths of marijuana or cannabis that they were taking. After the 5 day period, the subjects rated their level of pain. The highest dosage of THC, which was 9.4%, was shown to lower the pain level on average from 6.1 to 5.4. Now, even though that's just a small change, the study notes that most strains sold on the street are at about 10% or about 15% THC levels, and therefore may have produced an even lower pain rating. So they just to not get anybody addicted to marijuana, they didn't go that route of allowing these people the higher levels of THC, but just as kind of a study to just to to check it out, is experiment. So according to PolicyMike.com, the effects are several hundred times more powerful than that of aspirin. So cannabis was blowing aspirin and acetaminophen and things of that nature completely out of the water. Also, THC was used for sleep. According to the National Cancer Institute, test subjects who inhaled marijuana had improved mood and less anxiety. And normally that's what allows us to sleep, being able to be rest-free or allowing, let's say, RES phase. Is it RES? REM. Yes. Rapid eye movement, which allows people to know, or in studies, it allows people to know that that's when people are really in their deepest form of sleep, when your body enters REM phase, or restless eye movement. Also, marijuana was used as a treatment for cancer and, as I said, AIDS and MS. In perhaps the most unexpected news yet, scientists announced last month that THC, an active ingredient in cannabis, was effective in stopping the spread of HIV in monkeys. Now, that's wild in itself, but they use monkeys a lot to test their systems against the human systems. Supposedly they're closely related. So it helps in stopping the spread of HIV in monkeys. A 2012 study found that a marijuana compound can stop metastasis in some kinds of aggressive cancer. Last year, a similar study found that certain non-psychoactive cannabinoids resulted in dramatic reductions in cell viability and caused a simultaneous arrest at all phases of the cell cycle in leukemia cells. So researchers in the UK have already been able to use marijuana compounds to kill cancer cells in leukemia patients, which is light years ahead of what people have been trying with other medications and chemotherapy and things of that nature. So one of the things they're doing, they're allowing is Marinol. So Marinol explained, Marinol is the only U.S. FDA approved synthetic cannabinoid. It is often marketed as a legal pharmaceutical alternative to natural cannabis. Now, Marinol is manufactured as a gelatin capsule containing synthetic THC and sesame oil. It is taken orally and is available in 2.5, 5, and 10 milligram doses. Marinol may be prescribed for the treatment of weight loss in patients with AIDS and for the treatment of nausea and vomiting associated with cancer chemotherapy, which anybody who's known anybody to go through chemotherapy, it's devastating for some. Despite FDA approval, Marinol typically provides only limited relief to select patients, particularly when compared to natural cannabis and its cannabinoids. Marinol should remain a legal option for patients, or according to normal.com, Marinol should remain a legal option for patients and physicians. However, federal and state laws should be amended to allow for those patients who are unresponsive to synthetic THC. The ability to use natural cannabis and its cannabinoids as a medical therapy without fear of arrest or criminal prosecution. So by prohibiting the possession and use of natural cannabis and its cannabinoids, patients are unnecessarily restricted to use a synthetic substitute that lacks much of the therapeutic effects of natural cannabis. Um, so in conclusion, basically, before we even get to the conclusion, my wife was prescribed Marinol, and on it she was given a 2.5 milligram dosage, and that's like one pill a day. One pill a day. Okay, so we did a test at one pill a day. It seemed to not really have an effect on her at all. So at 2.5, what we did, we just upped it to two pills, and at two pills, even that didn't have an effect, or a noticeable effect. So basically, using the synthetic over the natural is a almost complete waste of time. So without going to jail, we would all like to be able to, for pain and things of that nature, to be able to use marijuana legally. So this will conclude my speech, and I thank you for your time.